Hello, students. Welcome to Workforce Safety and Wellness. This is Chapter 2 from your EMT program. Again, I'm Jeff. Good to see you again. We're picking up where we left off, and we're going to start on Chapter 2 for your program. So, Workforce Safety and Wellness, this is about you. It's about you, it's about your compadres that you work with, and how we take care of each other and make sure that we're all safe and that we're well throughout our work and our travels. All right, to be successful in this career, that involves with taking care of people, okay, taking care of others. It requires for you to value yourself first. I mean, that is huge. You have to protect yourself first. If you don't value yourself first, you may get injured or you may get killed. Scene safety BSI, you're going to hear that all throughout your program. That is a very big thing that you're able to recognize those risks that may hurt you or your partner or other people that are on scene. You'll also learn how to avoid those hazards. So this is part of, what your career is going to be is to be taking care of yourself as number one, and then take care of your patients. Because if you can't take care of yourself, or if you get injured, or God forbid you get killed, you're going to not be able to take care of your patients. So general wellness principles. Hey, health is a very complex interaction between physical, mental, and emotional connections. Plain and simple. You got to be well to do this. Chronic physical, mental, and emotional stresses are going to increase your chances of developing health problems. Spending enough time in this particular field, you're definitely going to get exposed to a lot of physical and mental and emotional stresses. So you need to stay healthy, stay in good physical and mental shape, emotional health. You need to be able to recognize that when you need to either help someone or help yourself, because you're having these stresses under the jobs, how to seek that professional help. Wellness is an active pursuit of the state of good health, and we've got to stay well as being an EMT or a paramedic in our respective fields. Nutrition, big part of it. We got to eat good food, okay? You got to eat good food. Eat regular, well balanced meals. Healthy eating includes nutrient dense forms of foods and beverages across food groups. Limit added sugar, saturated fats, sodium, and alcohol. When thirsty, drink water. Carry a reusable water bottle with you at all points at times. Exercise and relaxation. Hey, you got to balance these two things. Regular exercise is going to help you and enhances your benefits of maintaining, good nutrition and adequate hydration. When you're in good physical condition, you can handle more stress. To maintain good health, the American Heart Association recommends all of this. Each week, at least 150 minutes of moderate intensity aerobic activity and 75 minutes of vigorous aerobic activity or a combination thereof. 2 days a week, moderate to high intensity muscle strengthening type of exercises. Just as exercise is important to overall health, so is relaxation. You got to have time off. Take the time off. You got to have time off. You got to get relaxed. Don't pull so much overtime. If any, some people do no overtime because this is stressful enough as a job. So make sure you balance these two. Sleep, got to get it. Adults need a minimum of 7 hours of sleep per night. Now, half of EMS personnel get less than 6 hours of sleep if they're working 24-hour shifts. Many of these types of shifts have gone away. Versus 24, you're working 12s or you're on different shift interchange times. So short-term effects of sleep deprivation can lead to medical error problems, having difficulty focusing when you're driving or taking care of your patients. Long-term effects can be hypertension, sleep apnea, respiratory issues, diabetes, depression, and other types of medical conditions. So we need to get sleep. These are your recommendations. Make your sleep a priority, plain and simple. Don't shortchange yourself. Make it a schedule. Dark, cool environment, pre-sleep routine. Avoid pre-sleep meals. Make sure to have enough time and exercise. Stay hydrated. This is a big one. Hydration is a big, important part of what we do. Hydrate or die is one of those statements you're here in the desert all the time. So pay attention to that. Then develop strategies for sleep problems. Okay, how are you going to get there? Counting sheep, relaxation music. It could be anything. And then naps. Naps are good. Naps are a tool. It helps you to catch up as you go along throughout the day. And then plan your transition to the days that you're off. Evidence-based guidelines for fatigue risk management. You got to avoid these kind of things. You've got to monitor your fatigue. You got to, reduce your risk management. So you should at least work shifts that are shorter than 24 hours. If you can do that, if the place you're working is less than 24 hours, it's fine. Have access to caffeine to stave off fatigue. Have the opportunity to nap while on duty and mitigate fatigue, and then receive education and training on that mitigation. Most people that you go to work for will have these kind of training exercises, and they'll make sure that you have downtime so that you can get some rest. Recommendations to combat fatigue, all of these. Adequate duration and quality of sleep. We're allowed to take 20 to 30-minute naps. That's very, very good. It helps you to catch up. Increase physical exercise, and be careful about caffeine. Don't overdo it. I'm not a real proponent of monster drinks and those kind of things because they tend to give you all this wonderful quick energy, but the crash afterward could be even worse. It makes you even more fatigued. Engage in mental exercise such as conversation or games while you're working. Stress management. Hey, stress is a huge factor in our job. Okay. Managing stress is very crucial. We all have what's called a stress bucket. It's an analogy to understand what stress is. Everyone has a bucket, collects water droplets or daily stressors. When the bucket overflows, you get negative health consequences. So how do we manage that? We need to manage it. Effective stress management involves finding ways to empty that bucket out slowly so it does not ever get full. Relaxation techniques, exercise, talk, conversation, do what makes you feel good. Here's that bucket. This is in your book. It's about the Barabian and Turkington stress bucket. It's a pretty good analogy to let you know how you can release some of that, as you go on throughout your day, as that stress pours on, man, it just absolutely pours on. And we need to be able to release these slowly throughout our day. So, disease prevention and health promotion. Disease prevention is focused on medical care and prevention. We all need to have our immunizations. This is why we ask you about your immunizations. We need to have that to make sure that you have immunizations of the things you're going to be exposed to. Health promotion is focused on personal and social practices, to improve your health, exercise, regular diet, reducing your stress, those kind of things. That's health promotion. Smoking, vaping, or chewing nicotine. Well, it leads to cardiovascular and respiratory disease. We know that nicotine is bad for you. Smokeless tobacco is associated with cancers of the throat, mouth, and also the pancreas. Vaping has been shown to produce negative effects on cardiovascular and respiratory systems, contributing to an elevated risk of heart disease and stroke. And again, we're still studying the effects of vapes, but it's not good for you. I mean, what has shown so far is that it has a lot of negative effects that we need to be thinking about before we use that as a nicotine substitute or a smoking substitute. Alcohol use. It's acceptable in moderate alcohol consumption, 1 drink per day for women, 2 drinks per day for men. Excessive alcohol use is no bueno, no good for you. Causes nearly 180,000 deaths in the U.S. from 2020 to 2021. So between liver disease, car accidents, general intoxication related types of accidents, things like that. It also is a relationship between alcohol and risk of heart disease, stroke, and mental illness. So, curb the alcohol. Take it easy. There's no reason. I know I'm very foggy if I have any, so I just limit my alcohol consumption to a Friday night or a Saturday night, one or the other, and then I don't partake through the rest of the week. It's just not good for you. Cannabis use. Well, marijuana contains chemical compounds called cannabinoids. Cannabinoids interact with the endocannabinoid system, which regulates mood, memory, pain sensation, and appetite. Despite many places about legalization, Use of cannabis and cannabinoid products is not without risk. And we also need to remember that, you're a healthcare professional and you cannot be addicted to any kind of drugs. So, you can't, you need to be advised that this is not the place to be doing this because you cannot be under the influence. So, cannot be an EMT and use of cannabis. Don't think that that's something that can be part of your routine. Cannabis use among EMT poses important implications for workforce. Your cognitive and motor function goes down the toilet, so it's not so good. Research suggests that cannabis may also have prolonged effects on attention and the ability to function, your cognitive function. So know and understand your agency's policies related to cannabis use. Don't just automatically say, hey, I have a card, I can do this. Yes, you can't stop me. Well, make sure you know what the policy is. Balancing work and family and health. Don't let the job and affect your needs. I mean, whatever job it is that you're doing, don't let it affect your needs for your family. Your balance of personal life is very, very important because if you don't balance, your ability to do the job is going to decline. Take time to rest, recharge, and connect with others. Have fun. Go out and live. You only have so much time on this planet, so make sure that you're living a full, healthy life. Burnout, it happens and you see them. Okay, you'll see them throughout your program. You'll run into people and say, man, I don't want to be here. Or, oh God, if I have to go pick up that patient one more time, I'm going to kill myself. Those kind of things. That's somebody who's just been on the job for too long, or they haven't taken enough time off. There's a lot of emotion, a lot of stress that goes with this job. What happens is it manifests a cynicism or exhaustion of our brain. Then we get sarcastic, and being sarcastic is not funny at all. Many people will take offense to some of the things that people say. So it results, you end up not being want to do in the job. You don't want to show up for work, those kind of things. So you need to make sure that you don't go down this pathway. And if you feel like you are, talk to somebody about it. And EMS, burnout is a negative consequences for individuals and organizations. This is not a win-win situation for anybody. So it's not inevitable. You don't have to have this. You aren't going to eventually get it. I mean, I started, doing EMS in 1979, and I feel great. I still work, as a paramedic. I still work as a flight medic. I really enjoy what I do. I really enjoy teaching, and I balance my work and my life, my personal life. So I can have plenty of time for time off and to go do the things that I want to do. So it is a dynamic condition that can be managed. You can overcome it. You can get through it. So make sure you're working on that. So compassion fatigue. That's another word. This is new. This is a gradual lessening of compassion where you get kind of numb. It comes from seeing things, exposure to traumatic events, over and over and over and over and over again. Well, your empathy begins to leave. Okay, it's common, upon those who work in EMS and those that work in, other type of healthcare situations. And when this happens, when your empathy goes away, you can't put yourself in their shoes and to be able to guide them as an advocate like you should. So these are one of those things that you need to recognize. Strategies for mitigating this problem, self-care practices. Talk to people, go to counseling. Regular self-care practices, seeking peer support, professional counseling. These are all strategies to help mitigate, this compassion fatigue. You don't want to get there. You want to be empathetic for your patients. You want to be able to empathize with them, put yourself in their shoes. You want to be able to be their advocate, to be there for them when they need you the most. And, staying away from compassion fatigue is a good thing to do. So potentially psychological traumatizing events and post-traumatic stress. EMS clinicians, EMTs and paramedics, EMRs are all exposed to trauma at higher rates than the general population. They don't always lead to mental health conditions, but it's kind of like having a cave. A lot of EMS workers have a cave inside your brain, and you keep stuffing all these things in there. You close that cave door, so nobody can see it. Well, that potentially builds up and can lead to a lot of problems. So you talk to folks. I mean, counseling is great. You have it both in your departments, within your healthcare facility, wherever you're working, a friend, a pastor, whatever. Make sure that we are defusing, our problems and making sure that we don't let them manifest themselves. Because, quite frankly, for many, many years, a lot of EMS workers, healthcare workers in general, have taken their own lives because of PTSD from what we see out in the field, and we don't manage correctly. So a little bit deeper about it, potentially psychological traumatic events cause PTSD. These are the symptoms, intrusive memories, flashbacks, nightmares, severe anxiety, uncontrollable thoughts about the particular events that bugs you the most. So if you have a partner that's experiencing this, this is where it's a two-way street. If they see you exhibiting the same kind of behaviors, they're going to want to talk to you and refer to you, refer you to help. Because if you miss this, folks have, committed suicide because of it. So we try to catch this as we go along, but recognize it's there. Recognize when you see something that's absolutely horrible that the average person will never see in their life. Share that with somebody and share your thoughts about how you feel and, what you experienced and how you can get through not seeing those images over and over and over again, because there is ways of doing that. There's lots of help out there to help you move forward on this. CISM, that is the stress management design to make sure that we have opportunities to look at the whole. Okay, it is developed to address the potentially psychological traumatizing situation. So these are support groups that you may have work in a very hot station where you're running call after call after call of hugely traumatic events. Like say if you're close to an interstate, your station is, you'll get a lot of these kind of events. So you may create these peer support groups. This is about managing as you go along. And like it says here, no one size fits all approach. Everybody's included, everybody's welcome. Doesn't matter whether you've been through an event or you haven't been through an event. It's really about prevention, about recognizing signs and symptoms and how you can cope with when things do happen and to make sure that you have an outlet that you can be heard. Resilience, post-traumatic growth. Hey, resilience is the capacity for an individual to cope and recover from a distress. So we have a certain level of this as human beings that we're able to move forward with. We're resilient to life in general. I mean, as we get older, we even build even more of that. These are all strategies to build that resilience. Support networks, self-care, foster positive mindsets. I love when I swing my feet off the side of the bed every day. And when I'm able to walk out, smell the earth, smell the air, and see the wonderful things going on, around me, whether I'm headed to work, whether it's a weekend, whatever the case may be. These strategies help to build resilience for life because you will have challenges. You will have challenges throughout your EMS career and throughout your life. And you'll get there. You will. You'll get there. And you'll get through it. It's like everybody else. Just work on that resilience. Right. A little bit continuing on post-traumatic growth. It's positive changes that arise from your struggles. Struggling to cope allows you to reconnect with yourself. I always tell people make a journal, write down your thoughts, write down how you feel about things so you can come back and you can readdress them. Because at the moment, it might not be the right time to address it, but you can write it down. You can write it down and you can think about it and then come back and reflect on it. Reflective exercises are very good Taking moral inventories are very good. These are things that we can do on a constant basis to help ourselves. And then connection. Okay, connection with other people, social support. Don't isolate yourself. You need to be able to talk about it. As human beings, we need to talk about our feelings. Don't be ashamed of them. Talk about them. Get with your pastor, get with your family, get with whoever it is that you feel comfort with, that you can speak about these things and help you get through it. Understanding and addressing risk for suicide. Research has shown that EMS agencies, clinicians specifically, die by suicide at a higher rate than the general population. We see a lot of stuff. We deal with a lot of stuff. We see a lot of death. We see a lot of dying. These are, just given truths because of the job that we undertake every day we go to work. These can be prevented. These can be prevented. They can be prevented through CISM programs, CISD programs, having debriefings, having regular scheduled events, to talk about these issues. The true causes of suicide is really, really complex. It involves just intersections between your personal side, your organizational, your relationships, your events that you've seen. There's so many complexities, so many fingers in the pie, as you would say, that get you up to that point. So there are so many opportunities to release that and have a seat and talk with somebody. I mean, if it's your partner, if it's your spouse, whoever the case may be, you need to do that. Okay, so you need to understand that these are good things. It's not a bad thing. This is a good thing to move forward with these feelings. Connection and belonging. You got to have that sense of belonging, that sense of connection. In our job, we all work together. We all watch each other's backs. Checking on one another is a part of what we do. Many organizations offer access to stress management and other kind of health services. It's there. It's called Employee Assistance Programs, or EAP. There's so many things out there. Then there's also, we talk about the Code Green, campaign. The Code Green campaign is a mental health and advocacy program in a specific organization for first responders, whether you're EMT, a paramedic, a firefighter, or a police officer, or whatever the case may be. It's called the Code Green campaign. Prevention and physical work-related injury. Ow, okay. We do get work-related injuries about 20,000 times, each year. EMS clinicians and emergency departments for work-related injuries report these kind of folks, EMTs, paramedics, that get something going on. As an EMT, you're most at risk for sprains and strains, exposure to blood, bodily fluids, and also falls. So we start off with safe lifting techniques. There's a whole section on this, and we're going to talk about that in that particular section. It's in Chapter 8 on how you lift and move people. I've seen many people in their careers, because they improperly lifted somebody or didn't have enough people to lift somebody, should I say, and lifted them incorrectly, they got injured permanently. So we'll address that in Chapter 8. Infections and communicable diseases. Pretty simple. Hey, treat everybody as if they're infectious. Okay, we treat everybody the same way. Infectious diseases caused by harmful organisms in the body, your body and their body, the patient. Remember, we don't want to spread disease to them either. So good hand washing is the number one way that we reduce spreading disease from one person to another. So communicable diseases can be spread from person to person or from one species to another. Infection risk can be minimized by doing something about it. Number one, get your immunizations. That's why, again, like I mentioned earlier, we require that you show us proof of immunization. And also some simple protective techniques in hand washing. As you can see, this person is sneezing or coughing into their arm. If you're not well, don't go to work, period. Don't come to school. We don't want you making other people sick. When you come, you need to be well, okay? You need to be healthy. So terminology, a little bit of terminology. Pathogen is a microorganism that's capable of causing disease in a susceptible host. Okay, so it's the thing that causes you to get sick. Contamination is the presence of pathogens or foreign bodies on or in objects such as dressings, water, food, needles, wounds, or a patient's body. Okay, so it's the boogers that are in there, the presence of those pathogens in there. So it's the contamination. Exposure is a situation in which a person has had contact with blood, bodily fluids, tissues, or airborne particles in a manner that may allow for the disease transmission to occur. PPEs, hey, that's pretty simple. Personal protective equipment. It's the things that we use in our workforce, whether it's a mask or whether it's gloves, to protect ourselves from pathogens or other hazardous conditions. All right, so routes of transmission. Direct contact, bloodborne pathogens. Direct contact, bloodborne pathogens, it's mean you're getting somebody's blood in your blood. Indirect contact, contaminated objects. Okay, so you're touching something contaminated with your hands. You don't wash your hands and then you put your fingers in your mouth or in your nose or something. You have done an indirect contact. And also indirect contact needle stick. If you have a needle that has blood in it, it's been used to draw blood, and you get stuck with it, that's a form of indirect contact. Airborne transmission, such as sneezing. As you can see here, this person in this photograph is sneezing and putting droplets into the air. You breathe those droplets, they were not kind enough to cover their face or wear a mask, and now you got it. The next one's foodborne transmission. You eat food that has some kind of pathogen in it, okay, that makes you sick. Then vector-borne. Vector-borne is from your fleas and your ticks and your mosquitoes, those kind of things. So those are the routes of transmission that you need to know. Direct contact, indirect contact, airborne transmission, foodborne transmission, and vector-borne transmission. Standard precautions. Seed safety, BSI. Again, you'll say that so many times it'll be ingrained in your head, no problem. All EMTs are trained in handling bloodborne pathogens. You'll get experience of this in class and lab on how to do it, how to remove gloves, how to wash your hands, how to report exposures, those kind of things. It's like it says here, and I reiterate this, treat everybody as they're potentially infected. If somebody's coughing or sneezing, have them wear a surgical mask. It's okay. And if for some reason they can't, you wear one while you're in contact with the patient. Apply infection control procedures to reduce the spread or the transmission of disease. And then if you do get exposed, notify your infection control officer. Proper hygiene, hand washing. I don't know how many times I've told you this. Hand washing is the simplest yet effective way to control disease transmission. Wash hands before and after patient contact, even if you wear gloves. Doesn't matter. Besides that, you want to get the stuff off your hands that's inside the gloves anyhow. So wash them. If there's no running water, use some waterless hand washing. That's that good old stuff that's got the alcohol gel in it. So make sure that we use something to clean our hands with if there's no water that's available. Gloves, wear gloves if there's any possibility. As you can see here, this person's wearing some pretty heavy duty gloves. Cleaning this up, it should be vinyl or nitrile. Latex gloves are really not out there in use anymore because a lot of people have allergies to latex. If you don't know whether you have one or not, you might want to find out before you stick your hand in anything like latex. Vinyl is safe and nitrile is safe. Removing, there is a technique, and we're going to talk about that in class on how to remove gloves properly. As you want to, the goal is to avoid contaminating yourself with materials and not causing any splatter that may get on somebody else or get on surfaces. Eye protection, very, very important. When I work, I always keep my eye protection with me. And notice that the eye protection that you see here, let's see, here, notice that it covers all of the portions of the eyes, and notice it's clear. Sunglasses and regular eyeglasses are not considered eye protection. Then, of course, over here you have the shield. There's a face shield. Those are especially helpful if you're going to be in a situation where you have a lot of spray and splatter. For instance, in childbirth, there's a lot of blood that is expelled during childbirth, so you want to wear lots of protection. Gowns, sometimes, like with childbirth, gowns are very, very helpful. They provide protection from extensive blood splatter. We were in, like I said, aerosol generating procedures when you're providing medication through oxygen delivery devices, so it's aerosolized. Field delivery of a baby, and then also patients with major trauma. Mask, respirators, and other barrier devices. Wear standard surgical masks for bodily fluid splatter. If you suspect a patient has an airborne or droplet disease, place a surgical mask on the patient. If they can wear one, that's the best thing to contain it right there. Okay. And then if that doesn't work, you can place a particulate respirator, such as an N95 mask, on yourself, and also make sure you have protective eyewear. Neither mouth-to-mouth or mass resuscitation is recommended. We use masks. We use delivery devices, such as what you see here. This is a mask with a valve on it that you can ventilate through to get air into their mouth and into their lungs to be able to resuscitate somebody. That valve's a one-way valve, so if somebody throws up when you're trying to do this, it won't come back up in through and into your mouth. You'll see these in your airway station as we move along, and also in the CPR portion. Donning and doffing PPEs. Donning is putting on full PPEs, and doffing is the removal. So you're going to perform in a consistent sequence to reduce the risk of contamination. Sharps. Anything sharp. Okay, needles. Needles are the big number one thing that we use in the field to do a lot of different procedures, including IVs, medication administration. When you're doing a simple glucose check, and you do this, that's a part of your job where you're testing somebody's sugar. Those sharps have to go into a plastic container. Employer responsibilities. OSHA regulations require that all employees be offered a workplace environment that reduces your risk for exposure. Okay, it's your responsibility to know, though, to know what those procedures are. So when you go to work, you should be trained on an infection control policy or procedure. How we manage infection controls. We'll talk about it during orientation. You will be told who your infection control officer is here at school that you're going to report to if you think you've been exposed. Establish an infection control routine. Clean the ambulance after each run and on a daily basis, period. Clean your unit quickly and get into service, okay? Address surfaces, use the proper materials that are provided to you by the ambulance company or the fire department. Reusable medical equipment should be cleaned and sterilized per your departmental procedures. Learn what these regulations are defining waste management and how we dispose of all these things. This is all part of your job or your responsibility as an EMT. Maintaining disease immunity. Even if pathogens, remember we talked about pathogens, that's that booger that gets inside of you that's not natural to your body, that wants to invade your body and make you sick. You're not necessarily at risk for infection if you do get a pathogen, especially if you've had vaccinations, such as hepatitis B. That's a big one. Okay, immunization is a major factor on determining whether a host is going to become ill, whether you're going to become ill when you get exposed. Gaining immunity. Well, one, having been immunized or vaccinated, or recovering from infection from that germ. And then again, we call it herd immunity, but it's a lifelong process. we get exposed to stuff all the time. We don't even know it. We get a little sniffles out of it, maybe a little cough out of it, but each time that happens, you're improving your immunity. So it's not a bad thing. It's how we all get immune from certain pathogens that are out there. Right, so immunization and testing prevention begins by maintaining your personal health. Stay well. Annual health examinations should be a part of your routine. Some testing is required, such as tuberculosis testing on an annual basis. And, knowing your history of childhood diseases. What if you had what you didn't have? Be able to talk very freely about this with your primary healthcare provider so that they can give you information that you need in the event that you do get exposed. The CDC recommends immunizations for the following at a minimum: hepatitis B, influenza, measles, mumps, and rubella, which is called the MMR, varicella vaccine, or having had chickenpox, also tetanus, diphtheria, and pertussis, or Tdap. These are all things that you had to have to go to school in high school. So you should have all of these at this point in time. And then specifically with healthcare providers, a skin test for tuberculosis or a blood test for tuberculosis on an annual basis, so we know what your status is annually. General post-exposure. If you're exposed to a patient's blood or bodily fluids, turn over patient care to another EMS provider. That's a test question. Don't forget that. That's a test question, because a lot of people say, oh, well, we're going to clean it first. Well, no. You're going to turn the patient over to somebody else, and then you're going to deal with your problem. Has to be to an equal or higher level EMS provider. So clean the exposed area. If your eyes are exposed, rinse your eyes for 20 minutes. Activate your department's infection control plan and complete an exposure report. Follow-up. Your follow-ups will be determined by your department that you work with, your infection control officer. Best way to reduce risk is through early activation of the department's infection control plan. If you're exposed to COVID-19 with proper PPEs, the CDC currently does not require work restrictions unless symptoms develop or if you test positive. Post-exposure and prophylaxis and treatment. Well, if you get what is considered as a significant exposure, okay, so this would be like a needle that's full of blood. It was pulled out of a patient and you somehow got stuck with it. That's a significant exposure. Only if the investigation will determine on any of these type of exposures with determination of effective, a significant exposure. You could have treatment with antiviral medications. With hepatitis B, you'd be tested for antibodies and given a hepatitis B immune globulin, which is a shot. Okay. As far as hepatitis C, there's no treatment. There's no treatment, no vaccine. Those are test questions. Study up on that. Tuberculosis. If the skin is test positive, treatment with oral anti-tuberculin type of medications are suggested. All right, so begin protecting yourself as soon as you are dispatched. At least at minimum of, put on your safety goggles, put on a couple of pairs of gloves. Be ready for when you arrive. Additional response and safety considerations: continue to protect yourself. Make sure that the scene is well marked, well lit. Place warning devices to alert other motorists on the scene. Park the vehicle to block traffic. And make sure that you're far enough away from the event. If something happens with the vehicle, or the event that you're working on, it creates a hazard, you're not going to be involved in it. Make sure there's plenty of light if it's dark. Everybody needs to be able to see everybody. And then wear anti-2 safety vests. That's so that you're glowing and so everybody can see you. Violence against EMS clinicians. Sometimes your patients get pretty rowdy on you, and you may end up being assaulted. The rate of violence-related injuries with work loss responders is 20 times higher than the overall rate. So training and practice to avoid these kind of techniques, to identify scenes of potential violence, de-escalation strategies, improving interpersonal communications, ongoing scene assessment, and dispatch identification and alerting for potential threats are all part of management of this. Recommendations for protection: training, 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 training in self-defense, physical and chemical restraint techniques, fitting and use of body armor. There's all kinds of things. This is all going to be driven by your departmental policy. Know what it is. Don't ever do something on your own without going through your department. Like, don't put on body armor, those kind of things, or especially you cannot arm yourself unless you're working in a tactical environment by which you're trained to do so. So don't do things on your own. Make sure you go through and find out what your departmental policy is, and then get training on it. They provide it for free. It's a part of your safety part of your particular job set, your job description. So find out what your policy is, and then make sure you follow it. Characteristics of an inclusive work environment. So being effective, taking care of well-being. We're all included. All employees feel valued, okay, and respected and able to contribute fully to their roles. This is one of the things that makes us feel good about where we work. This is the place that you want to be, man. So when you find that job, hang on to it. Don't move from one place to another all the time. I mean, it's just, especially if it's money driven, because there's no real money in EMS, trust me. Um, but the value of, you know, having inclusive type of environments where everybody gets along. We're a team. We have to function as a team. That's what EMS is all about. It's a team-based effort. There's no loners in this. We're all working together for the good of the patient. Do no harm. Remember that. EMT creed, do no harm. Combating incivility in incivility in the workplace. You know, boys are boys, girls are girls. Get them together, separate them, whatever. There's a lot of rude and disrespectful things that happen, and whether it's intentional or unintentional, it's life. Learn how to understand, talk about it, de-escalate it, have good, you know, good discussion about it, even if the perception of, say, discrimination is going on. This can weaken morale and motivation. So the goal is that inclusive environment, an environment that we all watch each other's backs, we protect each other. EMTs rely on that seamless collaboration between other providers, other firefighters, other EMTs, other first responders, law enforcement, management, and paramedics. I mean, we all work together for the common goal for the patient. So yeah, expect some of this, but we can combat it. Okay, we can combat it with positive things that we put in place. So all good stuff. Just work on it, but know that you're going to run into this. It just happens. There's no bed of roses for everybody. So you'll find some bumps in the road. Just manage them the best way you can. Sexual harassment. Any unwelcome sexual advances, requests for sexual favors, or other verbal or physical contact of a sexual nature when submitting is a condition of employment, submitting or rejecting on the basis of employment decision, conduct substantially interferes with performance and creates a hostile work environment. Bad, bad. You report this stuff. Mm-mm. If this ever happens as a student, you bring it directly to us. Okay, period, and let us manage it. Don't try to manage it yourself, because this is highly inappropriate in any environment. So just not acceptable. With that, two types to understand, and this is a test question: quid pro quo and also hostile environment. With quid pro quo, you do this for me, I do that for you, that kind of thing. Hostile work environments is any jokes, touching, leering, anything that's inappropriate. So, yeah. The intent of the harasser doesn't matter. You're not supposed to do this. It's illegal. It's against the law. Reporting harassment to your supervisor immediately. Me, student services, HR, wherever you need to take it, you take it, right away. As I said, as a student, you take it to us. You report it to us, and then we'll manage it from there. Cultural diversity. Hey, man, we got this all over the world. Okay, You're expected to work alongside coworkers with varying backgrounds, attitudes, beliefs, and values. That's all there is to it. We all got to get along. We all live on the same planet. Okay, there's no way to get away from that. We all live here, unless you go to space. We got to be an astronaut for that, not an EMT or a paramedic. But regardless, you know what I'm saying. We all work in the same planet, same place. Doesn't matter. We all got to get along. Cultural competence. That's the ability to deliver care in a way that meets the social and cultural and linguistic needs of the patient. So this is about the patient. You got to understand what their needs are. They may have a different cultural value. There's so many things that I can tell you as having trained people from all over the globe, in the Middle East, in the Philippines, in Europe, the Filipino bloc. Just so many different places, and they definitely have different cultural values. Cultural competence exists as on a continuum basis. So know your people, know your neighborhood, know what to expect in your run area, those kind of things. Cultural humility, it's a process in which a person remains curious about others and continuously reflects on other viewpoints with an open mind. That's where we all should be in our life. If we have a sense of humility about our own culture, we'll understand others a lot better. Keep an open mind, right? Things are different all over the planet, and we need to be open to those. We need to understand, their social, cultural, and linguistic needs, of our patients, and make sure they get what they need, especially in translation. Translators are a very, very important part of the healthcare, continuum. So let's do a quick review. A disease that can be spread from person to person is known as, what is it? What do y'all think? If you answered B, a communicable disease can be spread from one person to a species to another, you are correct. Yay. All right, there's your review and the explanation to this and the rationale. B is the correct answer. C is, not correct. It's communicable disease, and then D is not correct. It's communicable disease, and an infectious disease. The rationale: infectious disease is a medical condition caused by the growth and spread of small harmful organisms, not about spread from one to another. So communicable disease is the correct answer. The most effective way of preventing the spread of disease is, come on, you guys know this one. Absolutely. A, hand washing. Okay, hand washing. According to the CDC, the most effective way of preventing spread of disease is through hand washing, especially between patients. There is your reason behind that. All right, while caring for a trauma patient, the EMT has blood splashed into her eyes. Okay, this is an example of what? Infection, exposure, indirect contact, or transmission. What do you think? Remember, these are test questions, so bone up on them and look up. If you don't get it right the first time, look it up, write it down. If you answered B, you're correct. Exposure occurs when a person comes in direct or indirect contact with blood or bodily fluids. Blood splatter into the eyes is an example of direct contact. Direct contact. It's important to note that the exposure does not always lead to infection. Just because you got, contact doesn't mean you're going to get infected, you're going to get sick. It means you've been exposed. So proper use of PPEs minimizes that. So you never should have gotten that in your eyes to begin with. You should have been wearing, a pair of glasses, safety glasses. Well, caring for a trauma patient, that's again the EMT. You can read these on your own, but that's your rationale behind it. 4, protective measures that prevent healthcare workers from coming into contact with germs are referred to as exposure, standard precautions, transmission, or PPE. If you answered B, standard precautions, you are correct, because that's the whole picture. All of those are components of it, but this is the whole picture. Okay, it is standard precautions. There's the rationale behind that one. What is the second stage of response in the stress response known as general adaptation syndrome? This is a test question. You're going to see it. Absolutely. Is it recovery? Is it exhaustion? Is it alarm? Or is it reaction and resistance? So it's the second stage. What's the second one? And the answer is D. Body typically reacts to stress in three stages. First is the alarm response, which is followed by a reaction and resistance, and then recovery. So it was reaction and resistance. If the individual cannot reduce stress, the last stage may progress to exhaustion. So there it is. Recovery is the third stage. Exhaustion. If the third stage recovery is prolonged, then exhaustion will happen. First stage is alarm, and the second one is reaction and resistance. Bada bing, bada boom. All right, a condition characterized by re-experiencing an event and over-responding to the stimuli that recall the event is called acute stress reaction, delayed stress reaction, cumulative stress reaction, post-traumatic stress disorder. And the answer is D, post-traumatic stress disorder. It may develop after a person has experienced a psychological distressing event, and it keeps repeating itself. That was the big thing that was in that question. Let's take a look at it. It says over responding to stimuli that recall the event, recall and re-experiencing. That's PTSD. 7, blank is the fuel to make the body run. Sleep, exercise, food, work-life, and balance. What do you think? Fuel. C, yes, you need nutritious food, healthy diet, balance it. Whether you're, vegetarian, a pescatarian, or a meat eater, whatever you are, you got to have a balance of it. Balance with proper food, nutrition, and balance of good exercise. Which stage of grieving commonly results in blame? Denial, anger, hostility, bargaining, or depression? Results in blame. B, they may lash out at the EMT or blame the EMT for the unfortunate event. So the answer is B. And if you remember, B was anger and hostility. Okay. So that often results or commonly results in blame. They're blaming you, so they're going to get angry at you. Okay. And hostile. You should have done more. 9, placards are used on buildings, individual packages, storage lockers, or storage papers. What is a placard used on? On these choices. Placards are used on buildings and transportation vehicles. It's to tell you what chemicals are inside. Okay, you should have read that, and that's one of those test questions that you're probably going to see. All right, number 10, the 5 most common hazards associated with a structural fire is smoke, oxygen deficiency, high ambient temperatures, toxic gases, or building collapse. Sounds pretty good. Smoke, oxygen deficiency, inhalation of tar particles, injury from breaking glass, and building collapse. Smoke, high ambient temperatures, toxic gases, electric shock. No, not always. And tar, where does tar come from? Oxygen deficiency, high ambient temperatures, toxic gases, electrical shock. No, I mean, only if it's electrical inhibition. So the one that is definitely, y'all should have guessed it by now. We eliminated B, C, and D because they have components on there that's not on all fires associated with a structural fire. So they definitely can be different. It is A, the 5 hazards most commonly associated with structural fire are smoke, oxygen deficiency, high ambient temperatures, toxic gases, and building collapse. There you go. All right, everyone. I want to take a moment and say thank you very much. Appreciate your attention. Look forward to seeing you in class. And with that, we'll say adieu till we meet again.
See you guys later.